Kia ora koutou, my name's Carl Horsley. I'm an intensive care specialist at the Critical Care Complex at Middlemore Hospital, and I'm also the clinical lead for patient safety for the Commission. I hope that you and your whānau are well during these uncertain times. One of the challenges of being part of the intensive care community at the moment is trying to think ahead about what does COVID-19 mean for the way we normally do our work. And we've really had to engage our safety imagination to think about what might happen and how would we respond to that. And that's really involved us leaning very heavily on the relationships we have across the hospital. It means engaging with our engineers to create new negative pressure rooms, talking to our clinical psychologists about how do we support staff, engaging with cultural support about how do we support whānau when they can't be there at the most difficult times for their loved ones. And for all these, bringing all these viewpoints to bear about how do we make sure that we're working to a common purpose through collective action. For our staff, that really means engaging with them about what are the challenges we face and what are the things that we need from them, not just as passive participants, but as people who are bringing everything that they know and their experience to bear on these problems. And when we're designing interventions, we want to be making sure that they're focused on a few key things. Firstly, it has to be safe for our staff and our patients. Whatever we do, we have to look after them. Second, it has to be simple, and that means making sure that whatever interventions we are putting in place are really based on a deep understanding about how people actually work. So that when we're thinking about personal protective equipment, how do we design systems to support people when they're tired, when they're overwhelmed, when it's 2 in the morning and they're really, they're struggling. And so how do we support them during those times? Thirdly, it has to be sustainable. We don't know what the future holds, but we know that it's unlikely that this will be something that passes in the next few weeks and is likely to be a sustained problem that we have to respond to over a long period of time. And lastly, whatever we put in place, it has to be adaptable. We have to be able to rapidly change based on what we're seeing, about understanding how what we were expecting to happen may not happen, and instead thinking about what does this mean now? How do we have to change again? And constantly thinking about how do we adapt to these conditions. During this time, it's often hard for me personally. Being part of this it's been quite anxious, an anxious time, and some of the ways that I've really dealt with it have been about engaging and moving from anxiety really to action. What can I do to be part of this? What can I do to look after the people I work with? How can I be part of some collective that is able to deal with this the best way that we can? And I think for all of us, that's the secret, is about collective action. Matini mamano ki rapa te whai. By many, by thousands, the work will be accomplished.